Well, certainly the clients in the shelter system, the overall health status, both mental and physical, is very poor.
When you're homeless, you don't have a place to store your medications. You don't get regular sleep. There's not a place for you to get follow-up information from a healthcare provider.
Homeless people need to be respected. They want to feel connected. They want to feel that they can trust somebody.
Growing up in Canada, I didn't even know the word homeless, but here I am. The population is growing, cheaper foods are disappearing, and there's just not enough affordable housing to go around.
Someone living in a shelter, you know, it's a little bit difficult, to say the least, for them to kind of meet their healthcare needs effectively. I mean, I think it is for all of us. We wake up every morning and, you know, by the time we put our head on our pillow at night, we probably haven't drank our 8 glasses of water. We haven't gotten a well-balanced meal. We didn't exercise for the amount of time we should have. You know, there's lots of things that we haven't done to maintain wellness. So can you imagine trying to kind of do that, have that pressure, and also just be secure in your bed for the night, secure in your meal for the night, trying to kind of figure out how you're going to get enough money to get your medication or to be able to, you know, kind of manage your drug habit. It's not anything that can be well managed, but I believe people have strengths. And I believe that we need to kind of understand what those strengths are, and we need to work with those strengths, and we need to understand how do we fit into reducing harm for people in their lives and doing it from their perspective, not from our own agenda.
We need housing, a place to stay. We need food, something to eat. And our food needs to be nutritious.
People who are homeless are people like everyone else. And so the range of illnesses that would exist in the general population also exists with people who are homeless. So from diabetes to heart disease, they exist in people who are homeless just as much. There are certain illnesses that would certainly be affected by homelessness, such as infectious diseases, influenzas or H1N1 that we're going to be exposed to potentially this fall. Because people who are homeless often are in shelters, and shelters are high volume areas where there's many people who are residing, and so infectious diseases can spread more quickly.
I once had a mental health consumer say to me, if you think about my depression in the same way as you think about somebody having a disability, a physical disability, and being paralyzed and can't move. When I have my depression, I can't move. I can't get out of bed in the morning. That means I don't get up and clean the apartment. I probably don't eat very well because I eat whatever's in the house, and maybe there isn't very much.
I encounter the gamut of mental health issues, right from somebody who's just distraught because they've broken up with their girlfriend to somebody who is floridly psychotic, and everything in between.
It's a shame. Like I try referrals almost daily to get detoxes, you know, for some of our clients, you know. And when a person is ready for, I had enough, and you make calls and, no, I can't take you, you know, I'll put you on a waiting list. I mean, that's terrible, because there should be bids available for people that want it right there and then, because now they're ready to make that change. And it would save so much money if they did have the bids available.
I find that they treat you like you're like a nobody. Like, we'll get to you when we have time to get to you. And I've gone there and, been sick and been in excruciating pain. And they would say to me, well, you're just here for a quick fix. And I'd have to say to them, like, no, I'm not here for a quick fix or just limp for pain. I said, if that was the case, I wouldn't sit in an emergency for 12 hours. I could get a quick fix in 5 minutes. Like, I'm sick, there's something wrong with me, I'm not feeling well. So I just think everybody, the healthcare system's got to change the way they're thinking, doctors, nurses, whatever. Like, everybody is human, and everybody deserves to be treated equally.
The perception of staff, and I'm not labeling all staff, but the perception of staff is often based on experience, and the experience, there's a kind of vicious cycle where a lot of the homeless people are used to being treated badly, so they arrive being prepared to being treated badly, so they're rude to staff, and staff feel, well, they're only rude, I'm going to be rude back to them, and there's this kind of vicious cycle. There's also, a lot of the homeless people are substance abusers, so that they arrive either with the police or they're brought in, under the influence of some kind of substance, which makes their judgment less easy to get on with. Quite often they've been living on the streets. They haven't bathed for a long time. They've been sick or incontinent on themselves. So there's this kind of physical unpleasantness that possibly that turns staff against them, that puts them in a less nice light. If they're, if you have a homeless man of 65 who's sick and a neat 65-year-old in a shirt and tie sitting next to them, generally the caregiver is going to take the patient that they perceive is going to be less of a discomfort to them. And so often the homeless people end up waiting and other people going ahead of them time and time again. A lot of homeless people, especially in winter, end up in the emergency department because it's the only place that's not freezing. And so sometimes staff decide, oh, well, that's why they're there. So they just leave them. And often they go away. They spend a few hours there and they're gone, which is it's obviously the last thing we want, but from the staff's perspective is, problem solved, they're gone, we can get on with the next patient. So the homeless people do wait longer than they should.
One, being able to get a family doctor, to keep those appointments, to be consistent with appointments. Us in the normal population get an appointment card, put it in our wallet, write it on our calendar, and we go to that appointment, we get a prescription, we go to the drugstore, we get that filled, we take it home and put it in our medicine cabinet. We may or may not take it as we should. But if someone hasn't got that, if you're homeless, if you're lucky enough to get to the doctor the first time, chances are you're not going to. Chances are you even got a wallet to put the card in. To come back for the second one, no way of keeping a track of that appointment. If you get a prescription for medication, you may find out that there's barriers trying to fill that medication. Even if you're covered by social assistance, there's a $5 copay, but $5 doesn't sound much unless you haven't got absolutely any money at all, and then $5 is a big deal. And so often, even though an individual gets that prescription, the prescription's not filled. If the prescription is filled, chances are that it will not be taken properly, that it will be taken home. People live with other people, it's very communal, and the medication may get stolen, they may get shared, they may get whatever, but they probably aren't going to be taking as prescribed. And so there's all sorts of barriers like that.
So there's every aspect really of health care from that point of view, personal health care, can be affected by homelessness.